The skill we're going to perform is abdominal assessment. First is you need to introduce yourself and identify the patient using at least two identifiers. Hi ma'am, I'm Hardy Gamma Jr. I'm your nurse today, and you are, and what's your birth date? Then after that is you need to provide client privacy by closing the door and by closing the curtain. Then after that, you need to explain the procedure. So explain what are you going to do and why it is necessary. Then after that is you need to assess the patient. So you need to assess the character of any report of abdominal or lower back pain. So can you ask the patient in a simple way? So ma'am, can you feel any types of pain, or can you rate the pain that you feel? Then after that is you need to observe the patient's movement and position. Then after observe, next is you need to assess the patient normal bowel habit. So ask the patient, so how many times did you defecate in a day, sir or ma'am? Then next is you need also to ask the patient, so ma'am, did you have a previous or past abdominal surgery or trauma or diagnostic test of GI tract? Then after that is you need also to assess if patient has had a recent weight changes or intolerance to diet. So ma'am, can you tell me if there is a changes in your eating habit or eating pattern, and how many times did you eat in a day? Then after that is you need also to assess the indication of GI alterations. Then next is you need also to ask the patients about the medication. So, ma'am, are you taking anti-inflammatory medication or antibiotics? So, if the patient said yes or no, so not that. Then also you need to assess the patients or ask the patients about the family history. So, can you tell me, ma'am, about your family history? If there is a history of cancer, kidney diseases, also hypertension, alcoholism, or heart disease, and also history about the risk of HBV or Hep B virus exposure. Then after the assessment, you need to perform hand hygiene. After performing hygiene, you need to gather the supplies that need into the procedure. So first we have a drape, we have a tape, we have a marker or pen marker, and we have a stethoscope. Then after that is you need to prepare patient for abdominal assessment. So first you need to ask patient needs to empty bladder or defecate. So ma'am or sir, do you want to defecate or empty your bladder? So if the patient said no, so you need to keep patient's upper chest and legs draped. Then after the patient, you need to ensure that that room was warm. So you need to adjust the aircon if the patient is cold. Then next is you need to position patient properly. So usually the position of the patient is in supine position, and make sure the patient is comfortable in his or her position. Then after that is you need to expose area from just above the xiphoid process down to the symphysis pubis. The next is you need to maintain conversation during assessment and except during auscultation. So you need to explain steps calmly and slowly. Then ask patients to point to tender areas. So point to the tender areas. Then next is you need to perform the abdominal assessment. So in performing abdominal assessment, we have a four steps or process we use, so which is the IAPEPA. So we use inspection, auscultation, percussion, and palpation. So first you need to identify the landmarks during the dividing abdominal region into 4 quadrants. So which is we have a first quadrant, second quadrant, third quadrant, and fourth quadrant. The next is you need to you need to inspect skins of abdomen surface for color, scars, venous, patterns, rashes, lesions, stretch mark, and artificial openings. So you need to observe lesions for characteristics. Then next is you need to to ask the patient, so ma'am, are you administering injections? So if bruising was noted, so you need also to inspect the contour, so contour of the skin, and also if the abdomen is symmetry, and the surface motion of the abdomen noted masses, bulging or distension. Then also you need to note if any distension was generalized. Look for flanks on each side. So these are the flanks. Then after looks, next is you need to measure size of abdominal girth if suspected distension. So measure using the tape. Then mark the tape. Then after that is you need to turn off suction connected to an NGT momentarily, so if necessary. The next is you need to auscultate bowel sounds appropriately. So you need to ask patient not to talk. So ma'am, don't talk. So don't talk on a few minutes. So to assess you or to hear properly the bowel sounds. The next is bowel sounds. The next is listen at least 5 minutes before describing sounds as absent. So first, you need to auscultate for vascular sounds with bell of a stethoscope over the epigastric region. Then after that, you need to auscultate each quadrant. Then after auscultate, you need to position patient properly. So you need to position patient properly. Then you need to percuss each of the 4 quadrants. So noted areas of tympani and dullness. So you need to percuss. So you need to ask patient if abdomen feels unusually tight. So you need to determine if this was a recent development. So you need to position patient properly. Then note if patient experience pain. Then after percussion, next is you need to palpation. So light palpate over each quadrant. Palpate painful areas last. So note muscular resistance, distension, tenderness, and superficial muscles. So you need to observe patient's face for signs of discomfort. So like grimace, facial grimace. Then also you need to note if abdomen was firm or soft. To touch. Then palpate for a smooth ground and mass below umbilicus and above symphysis pubis. So ask patient had sensation of needing to void. Then after palpation, you need to note if there is abdominal problem, so that you palpate. So note the size, location, shape, consistency, tenderness, mobility, and texture of any masses that palpate. Then press one hand slowly into the tender areas and release quickly. Press and release quickly. Then noted if pain was aggravated. Then in evaluation, you need to compare assessment findings with previous assessment characteristics to identify the changes. And also you need to remove the drape. Then after the procedure, you need also to remove the drape. Then after that, recording and reporting. Then recording reporting. So you need to document appearance of abdomen quality of bowel sounds, presence of distension, abdominal circumstances, and presence and location of tenderness in appropriate record. And also you need to document evaluation of patient's learning. So record patient's ability to void and defecate, including description of output. Then also you need to report serious abnormal findings to nurse, in charge, and healthcare providers. So that is the procedure in performing the abdominal assessment. Thank you.